Let's talk to Cllr Corlett, who's Deputy Leader of the Labour Group at County Hall. Good morning, thanks for joining us.
Morning, Chris. Thanks for having me.
Do you think the County Council can afford not to do this?
Absolutely. I think it's absolutely obscene. And I think we need to look behind Councillor Borrett's spin to see this for the two things that it actually is. That Councillor Borrett has completely run out of ideas about how to solve this and is throwing money at private consultants without any evidence that this will work. I consider that a gamble with public money. And it's also an acknowledgement that they have absolutely no confidence in that their own Prime Minister will keep his promise to sort out social care. In that clip there from Councillor Borrett, which I noticed that you've had to take from the recording of the last Cabinet meeting because yet again he's failed to come on, he said we won't be able to meet care needs in the future. That horse has bolted already. Last week, we heard from the Director of Adult Social Care, James Bullion, say that there are currently 870 people in Norfolk whose care needs aren't being met. So we haven't got time to wait for these consultants to come in. They need to act urgently now to make sure that people are safe.
The challenges are clear, and as you mentioned, people like James Bullion have explained to us on BBC Radio Norfolk in the past. If they believe that this company, Newton Europe, has the expertise to improve the service and to deliver genuine improvements in Norfolk, they're right to call them in, aren't they?
No, they're right to take decisions based on evidence, and that bold claim doesn't stand up to any scrutiny. Now, we've been told in the briefing that's sent to councillors, the Q&A, the other local authorities that they've already worked in. So I had a look at that, and as recently as December, so last month in Leicestershire, who have already paid these consultants to go through this process, there were 1,000 people waiting for a care assessment. 170 people had their care assessed but were waiting for that care to begin. And over 1,500 people were overdue a review of their care, which means their care needs could have got significantly worse, but their care package won't have been changed to do that. So if this is about saving money, I would say at what cost? There's been no scrutiny of this. It's a very bold claim by Councillor Borrett. And like I say, it doesn't stand up to any scrutiny. We should be making evidence-based decisions with public money. I listened to Nick and Judith Taylor earlier, and they made some very compelling points as well. There are 99,000 unpaid carers in Norfolk who have been telling us for free what the problems are and coming up with very good ideas of how to solve it. People living with a disability or older people in Norfolk are experts in their own lives. They tell us very clearly what they need to lead good lives and not just exist. We should be working alongside those people and alongside staff who deliver the service, the skeleton staff that we've got left, and working together with them in the short term to come up with some solutions to keep things safe while we wait for a longer term settlement that clearly we're not going to get from the government. It is going to be about treading water until we can get a change of government.
The council is investing, the idea behind this is investing in early intervention and preventative measures as well. That's a good idea, isn't it? Because if it leads to a decrease in demand for complex needs later on, it's better for everybody.
Every decision that the council has made over the last few years, everything that's come to budget has said, this is about reshaping services to intervene earlier to bring down demand. I think your listeners would be absolutely astounded if they thought that the council wasn't already doing that. But the thing is with early intervention is that it takes years for those so-called benefits to be realised. I'm a passionate advocate for early intervention, but you cannot fund early intervention by pulling the rug out from underneath people who are in need of care at the moment. It takes years to realise those benefits, and people are suffering. Every day at the moment, I've got casework of people where they're losing care during the day so that some of that care can be given to somebody else, and the impact that they're not able to leave the house, and these are people that are should be leading full and active lives. They're going to college or they're going to work. That is the impact of this. We haven't got time to wait for, these private consultants to come in. Like I say, there's no evidence base that it's going to work.
So how do you do it now then? How would you do it? Because you've talked about the funding issues. The county council has looked at that and said it needs to save money. So the situation is what it is at the moment. What do you do differently?
So there's two sorts of things. There's the short-term things that we need to do to shore things up, and the council, led by James Bullion, working with the NHS, has been working really hard on this, and they have had to take over providing some care. We have got some county council staff directly stepping into that void to provide care. Of the big list of things that Bill Borrett sent round that was going to be looked at, insourcing was not one of them, and that is a real missed opportunity. So I would like to look at that as a serious issue. There was a massive discrepancy between what the NHS workforce is paid for equivalent work and what the social care workforce is paid. You could get to the end of this £6.5 million. They are not going to magic up a workforce. And what social care needs is people who are well paid, who are well treated and well trained to provide that social care. That should be our focus. If there's £6.5 million floating around, I would like to make sure that goes to staff and to unpaid carers to shore up the system at the moment. So we should scrap the private consultants. Alongside this, we should be holding our local MPs to account for their failure on social care. Liz Truss was the Treasury Minister. Her county councillors must have been speaking to her on a regular basis. We need to get back on them lobbying those. And to be fair to Andrew Jemison, the Cabinet Member for Finance, he's very strong on this and he's been very outspoken. We do need some urgent fair funding for social care from government. And like I said, the earlier solutions are we should be working alongside people living with a disability and older people who use social care, families who are unpaid carers and staff working in the system, and use their expertise to shore things up in the short term until we either get a change of government or we get the government keeping its promise on social care. This £6.5 million, if Leicestershire is anything to go by, is not going to do anything to solve the very, very fundamental problems that we're facing.
But it will only be £6.5 million if it works. That's an important point to make here, isn't it?
But what does working mean? That's what I mean. At what cost? If working means we get to the end of it, some money is saved, but Norfolk ends up with 1,000 people waiting for a care assessment and 1,500 with a massive overdue of review of their care, that will cause real human suffering. Like I said, there is absolutely no evidence to support this. It doesn't stand up to scrutiny. We're going to be doing our best to work with backbench councillors and other opposition councillors to give some scrutiny around this, because it looked like it was just thrown together, plucked from the air. There's just no evidence that this is going to work and solve the problems. And what it will do is delay doing anything about this cliff edge that we've already gone over. All of our efforts should be focused on these 870 people in Norfolk. That was last week. It's probably gone up since then, that have not got the care that they need to be safe in their own homes.
Cllr Corlett, who's the Deputy Leader of the Labour Group at County Hall, thank you for joining us this morning.